Great. I'd now like to introduce our presenter for today's webinar, Kathy Johnson. Kathy Johnson retired from her position as Administrator CEO at Johnson Memorial Health Services, or JMHS, located in Dawson, Minnesota, in 2015. She has more than 35 years of experience in the healthcare field, ranging from nursing assistant to administrator. Under Kathy's leadership, JMHS has been recognized at both the state and the national level for service excellence, quality, and financial viability. She received her Bachelor of Arts degree in Organizational Management and Communication from Concordia College St. Paul and holds an associate degree in nursing from Central Lakes College. She also holds certification as a healthcare executive through the University of Minnesota ISP program. Since retirement, Kathy has established Dynamic Advantage LLC as an avenue for her to assist others in being successful in the challenging environment of healthcare today. Thanks for joining us, Kathy. I will now switch screens and turn it over to you.
Thank you, Becky. And thank you all for joining us today. I make my home actually in Minnesota, but right now I am in sunny Arizona and enjoying these winter months when it's below zero weather in Minnesota. As Becky mentioned, I've had a great opportunity to work in a number of positions. I started out as a nursing assistant in healthcare and worked as an LPN and RN, assistant nurse manager, director of nursing, the CEO, as well as COO. And so it's been really helpful for me in looking at this particular subject, investing in staff satisfaction, the cost of turnover. Because when you've been in all of those positions, you can really relate to that. So let's go ahead and get started. Our objectives for today are to gain an understanding of the importance of investing in staff satisfaction, understand the cost and implications of staff turnover, explore the pros and cons of various methods of gathering staff feedback, and gain some insight on the importance of responding to staff feedback for improved staff retention. All right, so why should we be concerned with staff satisfaction? You know, what difference does it make? Well, the deal is it drives all of these things, and we're going to talk about each of them, but it drives the culture of the facility. The facility's culture is really leadership and how that's structured, which spills over into the staff satisfaction. And leadership, if your leaders don't know how to lead and they haven't been trained in such, then how do you expect your staff to be satisfied? You need to have some kind of a solid structure that you build your culture on. I like the Baldrige criteria personally, but use pieces from a number of things. The Studer, I love Hardwiring Excellence. He's got a lot of good ideas in that. Also, there's tons of good leadership books. The Cy Wickman, Good to Great. There's all kinds of things where you can pull bits and pieces out. But a good structure is the Baldrige criteria. And the quality of work, if your staff is not satisfied, then the quality of their work is not what you would like for it to be. You got to think about it. If you're a person who gets out of bed in the morning and you're like, I got to go to work again today, then, you know, are you going to go to work and treat patients and loving kindness and, you know, do whatever you can to take care of them and be good to your coworkers? Probably not. So the quality of the work that people do is really dependent on how satisfied they are. And then there's customer satisfaction. You know that the Studer folks have done tons of studies, and their statistic says that 5% of your customer satisfaction depends on your staff satisfaction. So if your staff is satisfied, your customer satisfaction is going to be higher than if your staff is not satisfied. And you know that now if you're a PPS hospital versus a critical access hospital, then you are judged by your customer satisfaction. It makes a difference in regards to your reimbursement. And reimbursement, even if you are a critical access hospital, you need to know that sooner or later, everybody's going to be held to quality standards to get paid. Right now, critical access is not entirely, they're still cost-based reimbursed, but I know there's several proposals to Medicare for trials that would incorporate pieces of quality along with that. So it's just something to be thinking about and to be prepared for. And then retention. If your staff is satisfied, they'll stay, you know, and you will not have that cost that comes with replacing staff. And on, I have to share on, at a unit, a nursing unit, Johnson Memorial, by the way, is a very small rural facility, but it consists of a nursing home and hospital, clinic, assisted living, and of course it has the ER and the ambulance service as well. But if our turnover rate got to 10, you know, I felt a little panic. But when I'd go to a meeting, especially on the nursing home side, where it was regional, I would hear people talking about 60 and 70% turnover rates, especially with their nursing assistants. But at Johnson Memorial, we really didn't have that issue, which was great, and we attributed that to the culture of our facility. So what are the direct costs of turnover? Well, according to the Robert Johnson Foundation, they say the average for RN turnover is $36,567, and it ranged from $22,000 to $64,000. However, that was in 2012. Well, now it's 2017, so my guess is that has gone up substantially. And also at that time, they said 20% of the annual wage of most physicians would be what the cost would be to replace that person, except for physicians. And of course, that is substantially higher. So termination is an issue in regards to the morale and everything else in your facility. The exit, you have the exit interview. You know, you may have severance. You're going to end up paying higher unemployment taxes. You're going to have vacation payout. So all of those things are actually, you know, going to affect you when there's a termination. And even when there's a resignation, you know, you still have to end up paying much of the same things. You're going to pay certainly the vacation payouts. You're not going to have the unemployment tax, but you're still going to do the exit interviews and do the follow-up pieces for those. And the cost of replacement, I think everybody's pretty familiar with those. You've got the advertising, the screening, you may do some testing, interviewing, and I don't know about every place, but a lot of times it's not just one person interviewing. You know, we always did team interviews, so you had some staff people who were going to be peers that were also involved in interviewing. And so you have the cost of their wages as well. You have verification of licensure and certifications. There may be travel. There may be relocation. All of those things are factors that cost you money. Then you get to training. You have orientation. You might have recertifications. You'll have skills assessments. And then rural facilities, and I got to work in a couple really pretty, one a little bigger rural, one a little smaller rural facility. And it was my experience that if I hired a new RN, new grad RN, that it took almost a year for them to actually get up to full speed. So there's certainly some cost with that. They could take care of patients after, you know, probably 3 weeks or so, but for them to get oriented to all the areas that they would be covering, it took a long time. And then there's the vacancy cost. You know, you may be paying other staff overtime to fill those positions, or you're bringing in temporary staff so that they can fill those positions while you're in the process of hunting for your replacement. And the deal is while it's costly, you really do want to hire a good fit, not just a warm body. All right, so our indirect or hidden costs, these are the things that we don't always think about. So what about the reduced quality of care? Well, you hire somebody in new, you are going to have a reduced quality of care. And even when someone leaves while you have that vacancy, you bring in temporary staffing, you know, they're not your staff. They're not really bought into your facility as much as your own staff. So it is going to affect that quality of care. What about the reduced morale? What happens there? The remaining staff have got to be impacted. And, you know, when you let somebody go, when you terminate somebody, you know, there's, no matter if you have a process, and I am hopeful that everyone has a process that they take people through before they terminate them, unless, of course, it's something outrageous that happened, like they struck a patient or something. You know, when they leave, you can't share information, but that person can say whatever they want. They'll say, oh, I never saw that coming, even though you probably met with them a half a dozen times, you know, and really tried to get them to get on the right path so that you didn't have to terminate them. So no matter, even if it's somebody who gave notice and they're leaving, they're spending those last 2 weeks telling people what their plans are, you know, saying their goodbyes. You know, there's lots going on. But if you terminate someone, people are always like, oh, who's going to be next? So there's always an impact on the morale when someone is fired, especially, and even if someone leaves. And how about lost productivity? From the exiting employee, like I said, they're already gone, even though they don't intend to be many times. And not only are they impacting their productivity, they're busy talking to the other staff so that they're impacting their productivity as well. And then once again, when you have the temporary staff, you know, that they're not going to be as productive. Number one, they don't know your facility as well, so they can't be. And then the increased workload. The remaining staff may be working more hours, trying to cover for the vacancy, you know, that was created. And so there's probably some overtime cost that comes with them picking up more shifts, you know. And if you have the other staff, the fill-in staff, they are very costly once again. So there is that. And the cost of the new staff, they have to get up to speed. So like I said, if you have a new RN, they take almost a year to get fully up to speed because you're orienting them in every area of your very small hospital. And even if you're not having to orient them to all the areas, they can't get up to speed and be as productive right out of the chute. They have to be less productive for a while, you know, but they will eventually get caught up. And then there's the historical knowledge. So any process changes that you've made or any initiatives that you've put in place, maybe in regards to your culture and whatnot, any new employees not going to know that. You're going to lose that with the other employees. So that native understanding of everything that's gone on is gone. So how do you get that out to the new people? You know, do you have that on your orientation checklist to talk about those things and bring them up to speed? Or, you know, how do you do that? but that's important for the new people to understand as well where you need to be. So let's talk about some tools that we can use for engaging our staff, because we know it's expensive. It's very expensive to replace them. So why not avoid them leaving? And I'm not saying that all turnover is bad turnover. There's times you have to let somebody go, or they're just not a good fit for your facility, or maybe they're in the wrong seat on the bus and they just need to move to a different position. But not all turnover is bad, but most of it is. So for tools of engagement, well, I think that sharing information is one of the most important things that there is. So I like to use the term share information shamelessly. And there's a number of ways that you can do that to help employees feel like they know what's going on. So some of the things that I've used are employee forums, and some people have them monthly, some people have them quarterly, but it's a great place to share information. So I've always shared financial information so everyone knows exactly where we're at. We had ours quarterly, so we could share the quarterly financials with them and just the overall picture. You would want the managers to share the specific department information at their staff meetings as well. But we also share what we call a strategy map, but it's all of our strategies that the board has set, as well as the balanced scorecard, which shows the goals and where we're at as a facility with those goals at every employee forum. And it's a great place to introduce a new policy. You know, if you've had stuff that came up, talk about a building project, whatever it is that's on the plate, it's a great place to share that. And then most places have a newsletter. We put ours out once a month, and people were free to put information in the newsletter. There's the intranet. Some people have an intranet, and it's kind of a employee private network where you can put information out there specific to your employees that's not for the public necessarily. And staff meetings, one of the things that I found to be very effective back when I was in particular the director of nursing and running the monthly staff meetings on a regular basis, I would put the items that I had for the agenda on the agenda, and then I would post the agenda in the break room and let the staff add whatever they wanted to on the agenda, so that it wasn't always just the things that I wanted to talk about, but also the things that they wanted to talk about. And then I would check it periodically, because you never know, there might be something on there that you had to actually do some additional preparation for. So that turned out to be really a good tool for them feeling like they were engaged and had a more say in what was being talked about. So I also post information publicly and shamelessly. If you're doing poorly on something, that was always a big gripe when I first went in particular to Johnson Memorial. We were doing poorly on some things that came back in the patient satisfaction surveys, so we posted that in the facility, and people were like, well, you can't post that. And here's the news flash. You know, if you're doing poorly on it, people are giving you that feedback. They already know you're not doing well on it. So by posting it, at least you're letting them know that you're aware of it, and that they can be hopeful that that will change. I also posted the financial information in the hallway on the information board, so people could see that, as well as the hospital's goals, as well as the behavioral challenge that we were working on each quarter. So how do you gather feedback from the staff? There's a lot of different methods of doing that. and some are more effective than others, but survey is certainly effective, and it can be internal versus external. Now, I'm going to tell you an internal story. When I first went to Johnson Memorial, the person who was there before me as the CEO did an internal survey. But he managed to number the survey some way so that he could tell which employees belonged to which survey, which would have not been quite so bad if he would have never let that be known. But some employee made a comment that he didn't care for, and he called that person out in a public meeting. And so when I came and wanted to do a survey, nobody trusted that it would be confidential. So I've always gone with the external, and that was actually, before I went there, I used external surveys as well. But people seem to have more confidence that it's private, they can say what they want to, and you'll get that feedback, but it won't even be in their handwriting. And the one that I found to be get the best participation in was the Gallup survey, because it's only 12 questions. And you can use Gallup for that, or, you know, there are other people that will do slight variations of that because there is a cost to that. So when you're gathering that information, you have to decide, is the cost worth it? The other thing to remember is you might want to not do it every year, do an employee survey, because after a while, depending on how you respond to the survey, the people are going to say, well, there's no point in doing the survey because they never listen to what we say anyway. Now, the next thing I want to talk about is rounding. And rounding comes right from Clint Studer's Hardwiring Excellent book. And we actually took his form and we used that for a while, and then decided that that should be expanded on. So we have every employee talk to on a one-to-one basis at least 4 times a year. In the smaller departments, they rounded on their employees monthly. But the larger ones, like the nursing home where they had 100 employees, the assistant nurse manager and the nurse manager would divide them up, and it would take the whole quarter to actually get through them. And I have attached, and we'll be talking about the tool that I have for rounding, but we found that to be very effective. And like I said, developed our own, which I will share with you. And performance reviews, that's a great time to give people feedback, but it's also a great time to get feedback. And the performance review should be exactly that. It should be a review of the things that you have talked about through the years. It's really unfair if you're hitting a person with something they did several months ago and you didn't talk to them about it and you bring it up at their performance review. Yeah, if it happened last week, you might do that. But it should just be a review of the last year. And the other thing about performance reviews that I found is, especially in the small facilities, people are expected to do everything. They might be doing OB and inpatient and surgery and ER and outpatient, and maybe they're not great at all of those things. And really, should we expect them to be great at all of those things? They have to be adequate, certainly, to be able to perform their job. But they probably have some things that they really stand out in, that they really do a good job in, some skills that they are far above everyone else. So when I'm looking at performance reviews, what I like to do is I like to talk to them about the things that they're not doing so well that they need to maybe beef up on. But when we write goals off of their strengths and what they do very well and how they can use those strengths to either strengthen their unit or share those skills with other people who are struggling with that particular skill. And then there's staff meetings. Like I said, I post my agendas so that people can add to the agendas. Even as senior leaders, I had my group meet once a week, and the agenda was open for them to put whatever they wanted on that agenda as well. And so everybody gets to have their input on that. And we would start, when I had the monthly meetings in the nursing unit as director of nursing, I would start the meeting with rumor control. And so if I had heard rumors, I would just lay them on the table and we would talk about them. But I would also ask the staff if they had heard rumors so that we could address those and talk about those right at the time. As well as before the meeting was ended, even though they got an opportunity to write the agenda basically, they also had the opportunity to tell me if there was anything else that they wanted to talk about. Now, I know that sounds like that might be a little bit risky, but if something comes up, and I've had that happen where somebody was disgruntled about something and they just couldn't let it go. So in the end, I had to say, well, this is maybe not the platform for us to have that discussion, so I'm going to make an appointment for you to come and see me, and we'll talk about that privately. And then also there are employee forums. Once again, that's a great place to gather feedback because you want people, just like now, I mean, if you guys have a question or something you want me to go into more detail about, you should feel free to just let me know that, and I will do that. But at the employee forums, people got so that they were willing to speak up, or if there was something we didn't address that they wanted information about, when I would ask, is there anything else we need to address, they were more than willing to let me know if there was or was not. So that was really a great place for them to have a voice as well. The other thing that I don't have on here but wanted to mention to you is thank you notes. From the Studer experience that we had, thank you notes and rounding were the two things that we got the biggest bang for our buck out of. Thank you notes, every person has got a handwritten thank you note from me personally every year. So on a monthly basis, every manager would send an email to my executive assistant saying what they had noted someone doing that was over and above their job. And then I would write that person a thank you note, letting them know who told me that they did that, so that that manager would get recognition. And I had more employees come to me and thank me for those thank you notes and tell me how much it meant to them. And I mailed them to their homes, and so their families got to see them as well. So that was really something that they didn't, the feedback I got was just that they thanked me for it, but it was something that was very effective that I wanted to share with you. All right, now we're going to talk about that employee rounding tool. So we started out with a very simple tool, and we just kept tweaking it to make it our own. And so when people round on their employees, this is the tool that they use. When they have completed their rounding, they submit these to the executive assistant, and she doesn't read them all. She just goes in and documents that these employees have been rounded on. You know, because if you're not keeping track of if people are doing the thank you notes, if they're doing the rounding or whatever it is that you've had a directive for people to do, some people aren't going to do it. And the deal is, I'm too busy, you know, and people are busy. They have a lot of work. But in the end, we'll talk about that a little more, it does pay off. And a lot of people feel like, well, this employee gets a paycheck. They get paid for what they do. So, you know, what more do they need? But they do need some recognition. They need to know that you know who they are as people. So the first question that we have on our employee rounding tool is, what did I learn about this person? And there's spots for you to make notes about what did you learn about that person. Did you learn that they're going on a big trip, or they have a child who's participating in some major thing that you want to make a note about. Because on the second quarter, then you can ask about that. Or if you glance at this any other time, or for me, if I write it down, I remember it better. So the next time I see that person, I would be more likely to ask them about, well, how did that go? Or they have a sick family member, you can remember to ask, how is that family member? Then we start out with some very positive things, about what's working well today, and if there's any staff or practitioners that they want to have recognized, and why would they want them to be recognized. So it doesn't end up to be like a good old boys club, you recognize me, I'll recognize you. They need to actually tell you, what did that person do? If you were swamped and behind and some person jumped in after they were done with their work to help you, then maybe you want to recognize them for that. And then we ask if they have the tools, training, and equipment that they need to do their job. And where that question came from was right off of our employee survey. So we took the questions that we were low on the employee survey, and we incorporated them into the rounding tool so that we would have that opportunity to deal with those issues. And when we started doing this, then we could see the improvement almost immediately. One of the questions in the Gallup survey is, does my opinion count? Does my opinion count for anything, or some such wording? So we put on here, do you have an opinion or idea for system process improvements? Not an opinion to complain about somebody else, but if you have an idea how we can improve things, we'd like to hear about it. And then also, we review all the quality measures for their department when they get rounded on, because you'll see in the next couple of slides, that's going to have an impact on them, how their department does. And so they need to know that up front, and then they also need to own some of that. And tough questions. Well, one of the questions is also, does anybody talk to you about your development in the last several months? So we decided that we needed to do that. Number one, talk to people about where they thought their performance was, because sometimes the manager thinks very differently about where the performance is than the actual employee thinks. So it's nice to be able to make sure that you're on the same page. And then it asked about skills to further their development. And I have to tell you that in my career, that's the thing that I have found to be the very most rewarding. When I was doing patient care on the floor, it was seeing a patient recover and be well enough to go home. And as the management piece and the administration piece, it's been, how can I help people develop those skills and meet their goals so that they can be successful? It is so rewarding. They get rewarded because they are successful, and you get rewarded because you got to be a part of helping them be successful. So you address any other tough questions that are out there, maybe some rumors, whatever, but it's an opportunity for you to address that. And then in the bottom section, we want to know, what are you going to do next? What are you going to do now? Are you going to recognize the staff people that they wanted to recognize if there's some? Did they identify some barriers? Because the fact of the matter is, it's the manager's job to take away the barriers that keep people from doing their jobs. That's part of their job. And so if they can identify those barriers, then they can deal with them. Otherwise, they can't. And then when you go to the second quarter, you can look at these answers that you wrote down in the first quarter and see if there's anything you need to address, or see if something got better. And you can do the same for the third and fourth quarter. Then at the end of the year, we did all of our reviews in October. But at the end of that year then, you have this employee rounding tool that you can also use for some of the pieces of the performance review. Now let's talk a little bit about the performance review as well. Excuse me. This is merely the face sheet of the performance review, and at the top it's all a 1 to 5, and there's several pages behind us. But at the top of this page you'll see that it describes the ratings from 1 to 5, from distinguished to unsatisfactory. And then below that, it talks about the performance outcomes. Now, this is all about the individual's performance. And the tool that we use for the review is divided up into the pillars that we use for the goals for the facility and for the department. And these are actually the Studer pillars that we decided to adopt. So under the customer focus, there's service and community and quality. And under the team focus, there's people, growth, and financial. And while there's probably at least a page on each one of these, in the end, you score those and add them up and put them in the score. So for service and community, we bring that down to attitude. How well did you meet your customers' needs? And that's weighted very heavily. Actually, the heaviest, it's at 30%. And then for accuracy, you know, did you deliver? You know, were you productive, and were you accurate, and were you timely? And that comes down to 20% of their review. And for teamwork, how well did they work with other people and serve their team, because they are their internal customers? That's 20%. And under growth, there's change. How well do you handle change? And how well did you represent the team in regards to change? Were you the person that was cheerleading the change, or were you the person that was, this will never work? You know, we just need to go back to the old way. And that's 15% of their personal review. And then for financial, there's efficiency. You know, how well did they manage the resources that they do have? And that's 15%. So they put the number, the 1 to 5, that they get in here, and multiply that by the weight, and then over here they get a number, anywhere from 1 to 5, that they will be going onto their review. And here's the second half of that page, and this is where it gets really very interesting. On the top, you'll see it says total individual performance score, and that's from the last slide. So however they scored in their individual performance, that number's going to go over in the first box and be multiplied by 50%. So whatever their increase is going to be, it really is dependent only 50% of how they performed personally. And the other 50% is on how their department and the entire facility performed. So if the department met their goals, if their performance goals were high, that's great. That's going to be 30% of that person's raise. And the balanced scorecard, how the entire facility did, that's going to be great, because that's 20%. So their personal performance is only 50% of what determines what their increase is going to be. And then down here we have the point spread, you know, all the way from 0 to the 5. And then, of course, these percents of raise change annually depending on what it is that we have for a budget, you know, because it's not the same every year, and you have to stay within your budget. And I have to say we were fortunate we were able to give raises every year, even in the tough times, and even though we had a nursing home attached where the reimbursement was not what it should have been. So let's talk now a little bit about responding to staff feedback. Number one, why should you respond? You know, you did the work, you went out and you got the feedback, and you know, you have some tools, you can do that. But why do you have to let them know that you have responded? Well, the deal is if you don't, is when you start hearing, well, what's the point of telling them anything? They never listen anyway. So your staff satisfaction is not going to be where it should be if you don't respond. And the other thing is you need to respond effectively. So let's go back and talk about each of those things. For instance, the employee survey. So you take the employee survey, but what do you do with it? Well, what I did with it was at the employee forum, I showed all the employees the overall. You know, this is as a facility, this is how we did, which is also what I showed the board. And we would build some of our balanced scorecard goals off of how the facility did as a whole in regards to the employee satisfaction survey. But the other piece is every department also has their own survey that contributes to that. And how we handled that was the managers did not present it, but there was a time frame, probably within 2 months of when we got it back, where they needed to put it on their meeting agenda and make arrangements with either myself or the HR person that we would go and we presented the results of the survey to that staff, because we wanted it to be an open communication back and forth. And, you know, if they may have said that they didn't, some comment about their manager, it's hard for them to have the manager leading that discussion. So we would do that presenting, and as a part of that, we would also point out to them that the survey doesn't just belong to the manager, it belongs to the entire unit. So when we were talking about what items were low, we talked about how can the entire unit help make these higher? What are some things that could be done? And that seemed to work pretty well. And then when they did their department goals, they would have some things on the department goals from that survey. And then rounding has been well received in both of the facilities that I started that in. I also did some interim CEO work at a neighboring town and implemented many of these things. But the rounding gives that person that opportunity, like I said, to have that one-on-one time. But then how do you get back to people about that? How do you respond? Well, on the great big units, it was pretty easy on the smaller units because just at the next meeting you could talk about whatever things were issues, you know, and do the compliments of whatever things were not. But in the great big units, what they would do is they would go through their tool and they would take the comments and put them together and say communication was the issue. Then they might just write communication, you know, and what specific area, and then put on a matrix 10 people mentioned this so that everybody could know kind of what the good, bad, and the ugly was. And then they would present that at their staff meeting, but then they would also post that so that people could just review it as well. And performance reviews, they are, like I said, very important in regards to the fact that it's not just their performance, but it's the whole facility's performance and their department's performance. So if they have some skin in the game, they're a whole lot more interested in how everybody's doing versus just their little piece of it. And for staff meetings, you know, address their questions. Let them be a part of building the agenda. And that gives them that opportunity to actually feel like they own that meeting. And really, isn't it their meeting? I mean, you're going to share information, but it's a staff meeting. So it is the meeting where they should be able to bring up what's going well and what's not, and make plans. And then, of course, there's the employee forums. And remember I mentioned the thank you note where we had every manager sent us note about what somebody did. With the employee forums and also for the board meetings, we would put together a slideshow with that person's picture and what it was that they did that was extraordinary, and we would show that before the employee forum started so that people would be able to see what other people were doing. You know, a lot of times if people see that other people are doing good things, then they're more inclined to think that, oh, well, if they could do that, so can I. So those are just some ways where, you know, you can get back to people so that they know that you're heard. Now, the other thing is people sometimes, what you will hear is because you didn't choose to use their idea, they'll say, well, you know, I told them this idea, but they never listened. So if they come to you with an idea or bring it up at a staff meeting or whatever, and it's not an idea that you can use or fits into the plan for the facility, then a lot of times people think if you didn't do what they said, you didn't hear them. So you need to get back to them and just say, you know, just be honest. At this time, it's not something that fits into the goals for this facility. You know, when we do strategic planning again, certainly we can bring that up. But if they many times know the why, then at least they know that you heard what they said versus just ignoring it, and then they think you didn't listen. So that's important for people to know that you value what they say and how they feel. They don't want to be a number. They don't want to just be that employee gathering a paycheck, and if they do, maybe they're in the wrong position. So those are just some things that I thank you for giving me the opportunity to share with you, and I do appreciate having the opportunity to do so. Thank you.
Great. Well, thank you for all of that information, Kathy. At this time, we'd like to take questions from those of you who are joining us. So feel free to voice a question over the phone by pressing *2 to unmute your phone line, or go ahead and enter your questions into the chat box on the left side of the screen. And while we're waiting for questions to come in, Kathy, one question that came to my mind as I was listening to your presentation, with all of the different roles in healthcare that you've had throughout your career, all the way from nursing assistant to director of nursing to COO and CEO, how did your perspectives change along the way in terms of staff satisfaction? Did you notice different things in different roles? Were certain things more applicable or more relevant in certain roles?
Well, yes to all of that. Kind of a piece of it is when you've been there, you know, when you talk about what people say and what they do when there's a termination. Been there, done that, you know, because I was that staff person. And the other thing that really is helpful to you, I'll never forget the first time I was in a nursing assistant meeting and they were talking about something and I said, well, you know, when I was a nursing assistant, we tried this and it worked pretty well. You might want to try that. And they're like, you were a nursing assistant? Mm-hmm. Well, yeah. You know, and I also have found it very helpful when I've been visiting with physicians, because then, you know, they know that I have that experience and I have had that opportunity, especially as an RN and a director of nursing, to at least understand what they're talking about. So that's been very helpful. But from the satisfaction perspective, when you walked in their shoes, you know how they felt when this happened, or you didn't feel valued as an employee, or nobody cared about some idea you had. You know what that feels like. So unfortunately, I'd have to say that as I moved from one role to the next, most of the time I was thinking more about, I'm never going to do that to an employee versus the opposite. that I'm something that I want to do. I've many things that I would say. I don't ever want to make employees feel like that.
Great. Thanks for that answer, Kathy. How about anyone else on the line? You can press *2 to unmute or go ahead and type into the chat box. Well, feel free to continue thinking, and while we do that, I'm going to switch screens here to our closing screen. So thanks again to everyone for your participation today. The recording of today's webinar will be posted to our resource library within the next few days, and we'll send out that link as soon as it's available. Before you close out of the webinar, we ask that you please take a couple of minutes to complete the assessment questions you see on the screen. The first one is, how would you rate the relevance and appropriateness of this webinar topic to your network program work? Also, this presentation increased my knowledge on the importance of staff satisfaction. And finally, overall, how satisfied were you with this webinar? And in the middle there is a box to enter suggestions for future webinar topics. And if you have any ideas, please go ahead and enter those there because we would love to see them. Just a few quick TA reminders. We have a peer group call coming up on February 22nd when we'll be talking about preceptor site competency training and recruitment. The next round of TA check-in calls will be next month in March. We'll also be seeing a few of you in person at the facilitation workshop in Kansas City, Missouri, March 22nd and 23rd. I'm very much looking forward to that. Then our next webinar will be April